Good day, everyone, and welcome to this EBN web seminar, Why Sleep Belongs in Your Center of Excellence Strategy, How Leading Employers Are Rethinking Sleep as a Foundational Strategy. I'm Lynn Gresham with EBN, your host. Employers have built centers of excellence for cancer, surgery, maternity, and musculoskeletal care, but sleep remains one of the most overlooked drivers of healthcare costs, productivity, and chronic disease outcomes. Untreated sleep disorders can undermine investments in diabetes, obesity, cardiovascular, and mental health programs. In today's webinar, you're going to learn why sleep disorders remain underdiagnosed and undertreated, what defines a sleep center of excellence, how to evaluate outcomes beyond utilization and unit costs, and lessons from one employer's sleep benefit transformations. You'll find today's slides and case study in your related content area. Now I'm delighted to introduce our two speakers. Leading off is Dr. Heidi Riney, Chief Medical Officer at Knox Health. Dr. Riney is board-certified sleep medicine physician who has dedicated her career to improving access to high-quality sleep care and advancing innovative models that help patients achieve better long-term outcomes. She works closely with employers and health plans to address sleep as a foundational driver of chronic disease, member experience, and healthcare costs. Today, she's going to share why sleep deserves a place alongside other centers of excellence in employer benefit strategies. Also with us is Cheyenne Farr, Senior Benefits Analyst at Pilot Company. Cheyenne oversees Pilot's employee benefit strategy and has been closely involved in evaluating innovative approaches to improving employee health and the overall benefits experience. She's going to talk about why the company re-examined its approach to sleep care and what it learned along the way. Welcome, Cheyenne and Dr. Riney. I'll turn the program over to you now.
So thank you for that. So thank you, Lynn. Thank you, Cheyenne. Thank you, EBN, and everyone who's joined this webinar today. Now, before we talk specifically about sleep and really why it belongs in your center of excellence strategy, it's helpful to take a step back and look at why employers create centers of excellence in the first place. So just as Lynn said, a center of excellence really makes sense when a condition is common, expensive, and difficult to manage consistently. So these are conditions where you may see a wide variation in how people are diagnosed and treated, a complicated patient journey, and outcomes that really depend heavily on where someone receives their care and how well that care is coordinated. So we've already seen this model really used successfully in areas like cancer, orthopedics, cardiology, and musculoskeletal care. In each case, the goal isn't simply to point members to a care provider. It's really to create that consistent evidence-based experience, helping people really reach that right care sooner, reducing unnecessary delays and handoffs, coordinating care across the journey, and avoiding unnecessary procedures, treatments, and downstream costs. Now, what does that mean for the member? So for the member, that means clearer guidance, faster access, less confusion on what to do next, and greater confidence that they're receiving the right care at the right time. What does that mean for an employer? So hopefully that means more consistent quality for your members, better visibility into what those outcomes are, reduced variability and waste, and a greater likelihood that healthcare spending translates into meaningful clinical improvement. And really, that's where the value of a center of excellence comes in. It's that better member experience, more predictable quality and value for the employer, and ultimately that leads to better outcomes at a lower total cost of care. Now, Cheyenne, I might have you come off mute for a second and do better than I did there. Now, from Pilot's perspective, does that resonate with you? So when you think of a center of excellence, what's most important to you?
Definitely the team member quality of care. You often hear when someone tries to go through the normal marketplace coverage, they often have long wait times. They often have not ease of access to providers that can give them the specialized care that they need. And yeah, just overall, just making sure that they have those point of contacts with every stage of the process, because let's be honest, we're in the stage of instant gratification. So if they don't see results right there and then, a lot of people do quit. So, just making sure that they have that support that they need throughout their journey for sure.
That's great. Now, before we talk about what a sleep center of excellence looks like, I think it's really helpful to go back and answer some fundamental questions. So why should employers care about sleep in the first place? What happens when we sleep, and why does good sleep matter so much? And really the reverse of that is, how does poor sleep health contribute to chronic disease progression, increased healthcare utilization and those rising healthcare costs we've been talking about. So I think a lot of people, and it's better now than it maybe was a decade ago, but they look at sleep as a luxury. So really that thing that unfortunately gets cut when life gets busy, but really sleep isn't a luxury, it's a biological necessity. So it is, I would call it a vital sign really. And good sleep is the foundation of good health. And sleep is a physiologic active state, meaning when you go to sleep, everything doesn't shut down. A lot of really critical functions are happening with your body and brain during that time. So that's where, metabolism and hormones are balancing energy and your appetite. Your immune system is fighting off infections while cells are repairing themselves. Your heart rate slows down, your blood pressure dips, your blood vessels are relaxing, and really that's giving your cardiovascular system a chance to rest and recover. Your brain's consolidating memories, so it's really taking what you got in during the day so that it stays there, so hopefully you don't forget it when someone asks you again. It's sharpening your focus, helping managing your emotions. And I will use my analogy with my teenager. I know that when they don't sleep well, they really don't manage their emotions well, so we get more on edge, more irritable. But when all of these things are affected, what we see, unfortunately, is the downstream effects where you get an increased risk of metabolic, cardiovascular, and mental health problems. So there are 3 elements that really comprise good sleep health. One is, are you getting enough hours of sleep? So your sleep duration. Are you going to bed the same time and waking up the same time, what we call your sleep timing? That really goes with circadian rhythm issues, as well as restorative quality of sleep, meaning, hey, I might be going to bed the same time, I might be getting my hours, but is my brain waking up a lot due to a lot of disruptions? And so when you have all of those, you're able to get those essential restorative processes we've talked about. But if not, we'll talk about what the short-term and long-term implications are when we don't see that. So in the short term, really even one night of bad sleep can affect how we think the next day, how we feel, how we function. It can impact your memory, your focus, your decision-making. And that could be a big deal depending on what you do for a job, right? If you're in a safety-dependent job and your decision-making is impacted and you're maybe more impulsive in your decisions, unfortunately, the results of that can be pretty big. You may get issues with fatigue, sleepiness. And again, if you're driving, that's a big deal. I will say July for hospitals, when residents come in and new interns, that can be problematic sometimes. So when people aren't getting sleep, it can definitely have massive consequences. But you also may see issues where your appetite metabolism get affected. So the way you look at food even changes with one night of poor sleep. It makes you really crave those unhealthy foods. It can weaken your immune system, really leaving you vulnerable to infections, which would unfortunately make you miss work as well, and really can affect your cognition, mood, energy, and really overall day-to-day functioning. And so, Cheyenne, I'm going to maybe ask you one more time here. Really, before you implemented a sleep solution at Pilot, did you realize sleep was maybe contributing to some of this? And maybe the reverse is true. If you did you see a positive impact?
Yeah, 100%. And I think you covered like the top 3 things that we were seeing in our population. Safety is being a huge point of focus for Pilot right now. We do have a big population of drivers. Drivers is probably one of the unsafest jobs, popular jobs in America. And we often have people transporting, gasoline and diesel on a day-to-day basis. So making sure that they're focused is pivotal. So making sure that they get a good night's worth of rest, because to Heidi's point, one wrong split decision that they would make could potentially be life-threatening, which is definitely something that we want to avoid as much as possible. And then we were also seeing MSK and diabetes trends going through the roof. So seeing the inflammation impact that we see with, lack of sleep, as well as some of those unhealthier food decision makings, it definitely impacts those 2 conditions very much. So we definitely see a high comorbidity in that population that doesn't get the best of sleep or has like sleep apnea. So those comorbidities are very high for sure.
Thank you. So over time, so that short-term risk can become long-term, and it's unfortunately really prevalent. So it's, I think, about 50 to 70 million Americans suffer from a chronic sleep-wake disorder. And that's maybe about 20% of what you might see in a typical employer population. And so what that can do long-term is it can increase cardiovascular strain by increasing your blood pressure, your heart rate, that systemic inflammation you talked about, Cheyenne, and that can lead to increased risk of heart attack, stroke, and other cardiovascular events. Metabolically, it can increase your risk of insulin resistance and disrupt, again, those hormones that affect appetite. So again, it makes us look at those foods. And so increasing our risk of type 2 diabetes and obesity. And it can affect our mental, cognitive health. So there's higher risk of depression and anxiety when you have this, as well as an increased risk of cognitive decline and dementia. So it really impacts literally every organ system we can think of. Now, we talked about those long-term health consequences, but the question we also sometimes get is, well, what's actually happening physiologically that would lead to all those things? So why is it really affecting all of those different arenas? And so the two most common disorders, and Shane, you talked about it, was one is obstructive sleep apnea, and the other is chronic insomnia. And they are different, but both will interfere with restorative aspects of sleep and really what our body needs to recover and function properly. So chronic sleep impairment, whether from insomnia or obstructive sleep apnea, will trigger that repeated stress or fight or flight response throughout the night. With sleep apnea, you get the added thing where it may cause drops in our oxygen level throughout the night, where meaning your heart and brain aren't getting what they need. With sleep apnea, you get interrupted breathing during the night. People may be aware of the snoring issues that go with it, but the big issue is your airway is constantly opening and closing. And so it creates that fight or flight response, and in time can definitely lead to those issues. And with insomnia, the body remains in a heightened state of arousal and does not get that consolidated restorative sleep it needs. Both of them increase our cortisol, our sympathetic nervous system, again, that fight or flight part of our body, and over time can contribute to surges in our glucose or blood sugar levels, blood pressure spikes, that inflammation and metabolic dysfunction. And so what they do is when you're having this over and over and it's not being addressed or treated, beyond sleep, it starts affecting those other organ systems and can accelerate disease progression, making a lot of these chronic conditions that you're really trying to tackle through those center of excellence we talked about in other programs way more harder to control or to really manage, and ultimately more expensive because this isn't being addressed. And so this is where that bidirectional relationship happens between untreated sleep disorders and chronic conditions, where poor sleep can accelerate these chronic diseases, but chronic health conditions can trigger or worsen sleep disorders. And so again, left untreated, each of these kind of goes into this vicious cycle, again, leading to those poor health outcomes. And so these conditions also tend to cluster. So about 80% of untreated sleep apnea patients are going to have 2 or more chronic conditions. So these are often the same medically complex members who are driving really a high share of the cost that you're seeing with your healthcare utilization and costs. Now, a recent Brown and Brown claims analysis was looking at, well, let's understand what the financial impact is of these sleep disorders with these chronic conditions. And so they looked at about 3 million commercially insured adults and found that members with sleep conditions incurred 40 to 90% higher total healthcare cost than those same members without a sleep condition. And so among members who have multiple chronic conditions, those with a sleep condition cost about $6,500 more in annual healthcare costs. So again, it kind of goes with they fuel each other, but it's something that often is hidden that people aren't aware of. So really the big takeaway is that sleep disorders coexist with chronic disease. And if they're not treated, they can actively make those harder to address and to treat. Now, the question we often hear is, well, why? Why is this the case? Why is it so hard to address it? What's going on? And the issue is that sleep disorders often go undiagnosed and untreated, really because of how the traditional sleep journey is structured. So it's pretty fragmented. So when we talked about earlier, the center of excellence is really to try to make that a seamless journey. That's what we really see here, where members are often having to navigate 14 or more steps with often different providers at each of those steps, which involve referrals, prior authorizations, separate visit, testing, equipment, and follow-ups from there. And in many cases, it's often really on the member to figure out the next steps. So I always call them the quarterback of their own care here. So they're managing their chronic conditions often on their own, already individually, but then on top of that, multiple appointments with this and the handoffs that are needed. And sometimes they, again, don't realize that what's going on with my sleep may be impacting the other things I have. And for successful treatment, whether it's insomnia or sleep apnea, it often requires behavioral change, ongoing support, and coaching that really that traditional model doesn't consistently provide. So the result is really a process that can take 3 to 5 months to move someone from maybe recognizing I might have something going on to potentially getting to treatment. And the challenge with that is that's if everything goes right. What if someone has to reschedule their appointment, something happens, and then the clock starts again? And so that's where you see a lot of that dropout there. And on top of that, the inefficiency there is that every office visit, sleep test, interpretation of your test, getting your equipment, the device delivery is a billable event. So the member never starts therapy with all of that, or they start and they fall off. Those services actually don't translate into clinical improvement, right? You don't get the outcomes that you're trying to see. So about 70% of your traditional sleep care spending doesn't result in durable therapy persistence to treatment, really, meaning they're not on it 1 or 2 years later, because a fee-for-service model, unfortunately, is just paying for services, but not your outcomes. And that, unfortunately, hurts the member in the end, as well as the employer. And you can look at the outcomes there in the middle there. So in the traditional model, this was an analysis done by Risk Strategies a couple years ago, where they looked at their commercially insured population and looked at those who had a diagnosis of sleep apnea. And they found that of those with a diagnosis, only 49% of them adopted therapy. They looked a year later, well, how many of them are still on treatment? And it was 25% were on treatment a year later, 11% 2 years and beyond. So the issue isn't that effective treatment doesn't exist. It's the issues that the traditional care journey isn't really designed to keep members moving through the process. So again, that diagnosis, treatment adoption, the support that goes with it, and then long-term success with therapy. And when therapy isn't adopted or maintained, you continue to get poor sleep. And we talked about all the things that happen when we don't sleep well. And unfortunately, it's going to fuel those chronic conditions we're seeing. So this is really the gap that a sleep center of excellence is designed to solve.
And I would love that, Heidi, real quick, just from a real world like situation with even some of my closest friends, they have to wait 3 to 6 months to have a traditional provider get in contact with them. And then I know someone personally, they got a mask, it didn't fit. So instead of going back and being like, hey, help me, they just kind of gave up. So, it's those pivotal touch points with the centers of excellence where someone will actively reach out to you, make sure that mask is fitting, because they're just like, hey, I just can't sleep with this thing. So then they just give up. They don't know that they can go back out and be like, hey, I think I need a refit here. So I think that those are pivotal points in the journey that are often overlooked in the overall process. So I'm just going to echo everything that you said. This is definitely an issue that we see on a day-to-day.
It's huge. I mean, the fact that, I remember something else you had mentioned too, Shine, because I think that is huge. You're right that people will fall off there, especially if they don't know who to call or they don't know they have other options. And I remember you mentioning too that, people who don't live near where they can go somewhere, that can be a struggle, right? And I remember using the word health desert, and I was like, that is, you don't realize how hard it can be, right? How far it is, and who do I call? And I think we hear that too, which is sometimes people recognize they have an issue, but they don't know where to go to. And if they don't have someone nearby, it's really hard.
100%. Yeah. And I just feel like also like just having that advocate for you, because I really liked your quarterback kind of statement, just because, you need someone to help guide you. This is a complex situation, and you definitely need the care and support that, to guide you through the journey. Because if you told me to look at a dictionary right now, to look up all the things that are associated with sleep apnea, my eyes would just go cross-eyed. So I think just having that person to be your person, that's pivotal for sure.
That's great. So, and I think you've said it perfectly, which is, and I think hearing that is so helpful for us, because then it allows us to understand what are the parts of the journey that matter and what is helping, what do we have to keep optimizing, and really what is it is all about the member, right? So what are those pillars that are so crucial and define a sleep center of excellence? So really, what is it to remove the barriers to care that you're talking about, right? All of those steps, the length of time to really create those better sustainable outcomes. So one is designing around the member, where that entire experience is making it as easy as possible, right? Who is my point of contact? I need one person so I don't become the quarterback. They do it for me. They help me. How do we make it accessible, frictionless? And that includes the screening, the testing, seeing a physician, starting treatment, and then all that, and then that ongoing support, but doing it all from home, right? So that reduces the geographic mobility and socioeconomic barriers that make it hard for everyone to get really that coordinated care that's the same for all. And that coordinating experience really accelerates care. So we don't do that 3 to 6 months, allowing members to move from evaluation to treatment in as little as 30 days. Second is that having been clinically integrated, right? So we talked about on that slide before that people were going to different providers, right? And so now it's a different story every time you go and they don't know where you are in your journey. So having members where they really don't have to navigate that disconnected provider network and everything's on one platform. So that's your standardized testing, where everyone's going to get the same testing, that unified technology platform, integrated interactions, and the team is your sleep physicians, your behavioral care team, your respiratory therapists, medical managers, all there, again, making sure that the patient's in the middle and they know what's going on. Again, the goal is to get to that clear diagnosis, connect each member with the right treatment that works for them without that unnecessary delay or handoff. And then value-based. So what does that mean? That can be different for everyone, but in the traditional fee-for-service case that we talked about, you're paying for every service, every visit, every test, every transaction, again, regardless of what the outcomes are for the members. Our model is different. So payment is really tied to treatment adoption and outcomes rather than the volume of services rendered. So someone can go through screening, they can go see a physician, they can have a study, review the results, and if they don't proceed, there's no payment attached to that. It only happens when someone says, yes, I know something's going on, I know what it is, and I'm ready to start treatment. When people are motivated, they tend to be way more successful with treatment. And fourth is it delivers those outcomes that you can see. So both the member and the employer can see what are those outcomes. So then we're tracking, are members adopting treatment or starting therapy? Are they remaining adherent, meaning are they on treatment a year later after they started it? And are they persistent over time, meaning are they still on it 2 years and beyond? Not simply did we complete the test or was a device delivered? And then look at clinical improvement, member satisfaction, and then ultimately reduction of healthcare utilization and costs with those other things that you were talking about, Cheyenne. And really, when you put all of that together, when I kind of, organize it, that really would define a true sleep center of excellence. So, right, one that's member-centered, clinically integrated, value-based, that's accountable for those results. Now, when you look at it here, when we talk about outcomes, this is really just a slide to kind of reiterate what we're saying there, which again is over on the left, really what you can see traditionally to understand how someone's doing with sleep would be measuring, again, those volume of services delivered. So how many sleep tests were done, how many devices were shipped to them, how many claims were processed overall. Those metrics, again, tell you activity, but they don't actually tell you if someone's better, right? They don't actually understand, did we get meaningful value from this? And so when we add to what those outcomes that really need to be there to define a sleep center of excellence, it's going to be that shift there, which is, are we identifying more people who need care, right? So those people who have chronic conditions who likely have it, but maybe don't know and haven't been recognized, or were on treatment, but stopped. Are they getting on the right treatment for what they have? Are they still engaged 1 and 2 years later? Are their symptoms better? Is their clinical health improving? Are they happy with the therapy? And ultimately, again, are we reducing that total cost of care? And again, we talked about that. That is so important because ultimately we know they all are tied together. So sleep is one thing, but it ties into everything else. And so again, the true measure really isn't how many people do you test, it's how many lives are you able to improve and how many downstream health risks are you able to prevent or make better. Now, I really want to send over to the star of our show, and I know I'm not supposed to, I really want to pass it over to Cheyenne because I really want to understand from you, what does it actually look like in practice from your perspective? And how does implementing the program look like, and what's that impact been on your employee population?
For sure. And you did an amazing job on those slides. Let me tell you, medical is definitely hard to communicate to a lot of folks, but you did it very well. So I'm just going to talk to you all about a little bit about Pilot, just in case if any of you guys don't know about Pilot. We are a travel center focused company, but we do branch out into several different divisions. We have our energy sector, our corporate sector, our travel centers, and then our professional drivers. We do have about 900 plus locations with over 30,000 team members. So that's a very diverse population that we really need to account for when we think about strategies such as a sleep centers of excellence. And one of the biggest things is we have recently been acquired from Berkshire Hathaway. So a lot of our strategies are definitely being more longevity based. We're looking 5 years out, 10 years out, 20 years out sometimes, making sure that not only are the goals that we're setting out for are sustainable, but achievable. And one of those biggest things is making sure that we invest in our team members and showing people that they matter at every turn. So that is just a little bit about Pilot. And
So
then
I might jump
I
in
think
for you, Cheyenne, a little bit.
Yep.
These are maybe some questions I know we talked about earlier, but yeah, want to get your perspective a little bit about what challenges you were seeing before you all thought about implementing sleep. And I would say you were early in the process of recognizing the importance of sleep health. And what was it that led it? Was it coming from you all? Was it coming from members? Maybe a combination? And what wasn't the model that may not have been working?
For sure. So I think one of the biggest catalysts definitely came from our drivers. They have to go through certain DOT physicals, and making sure that they have sleep treatment if they have sleep apnea is one of the most pivotal parts of that journey. So making that more easily accessible to them, especially if they're in those health deserts that don't have ease of access to care. That was one of the biggest things that we were hearing from our population. So we definitely addressed that. Once we addressed that, we started seeing positive impacts to that population. We started seeing comorbidities go down. We saw a cohort analysis basically show that, not only that sleep treatment was helping their sleep disorders, but it was also helping their engagement, their safety awareness, just overall like being more present in their daily lives. And the feedback that we got from them was just over the moon for sure.
And did you anticipate that, I guess, when you started it? So was that, when you were hearing from the drivers, was that it? Or did you expect to see some of those improvements you were talking about?
Yeah, so some of them were kind of nice surprises. We were just like, holy cannoli, like not only is this great for, team members, but it's also great for the company as a whole, because it really shows that when you take action on your own health journey, you can actually see positive impacts outside of your health sphere, right? You look at it from a total well-being perspective. You can show up to your family more presently. You can show up to work more presently. And overall, your perception of life can be a lot better. And that's some of the feedback that we got from our team members, just basically being like, thank you for this service. Like, I didn't know what I didn't know. And now that I know, it's kind of a nice surprise. So I think we were delightfully surprised with some of the feedback that we got from team members, which made us kind of expand the program. We wanted to expand it to the rest of the company, which we did. And we wanted to make sure that people knew that this benefit was available to them, because not only are our drivers in some of these health deserts, but some of our retail locations, like we have some card lock locations that are in the middle of nowhere. So, finding care when they need it the most is very difficult. So, promoting a program like this to them to make sure that they know that things like this exist. I think some of the times it's the lack of just not knowing that things like this are available, right? You look at your healthcare and you're like, that's all I got. I need to go to a physician and they'll tell me what to do. And often there's more services that are available to them. So I think that allowed us to kind of open up. And I think that's the second question too. Why wasn't the model enough? It's because of those things. Like the access just wasn't there. So just making sure that team members knew that there's this alternative solution that just might make it a little bit more easier, not only to participate, but also adhere to the program, because those touch bases, they're pivotal to the journey for sure.
That's incredible.
And then I think we're on the third. What questions? I think I hit all the questions. I'm so sorry, Heidi.
No, that was all you did. You got them all, and it looked like you had success. But I was going to say, and it's really wonderful to see the success that you got, and even the ones that you weren't expecting. And I think that's right, because sleep does impact so much, and sometimes you don't realize it. And you made a great point, which is that people don't know what they don't know, right? If you've been dealing with it and you don't realize the vast impact, you might know one symptom, and then when you start seeing really how it can impact socially, your work life, but then also those other conditions. I mean, you're right. It has that effect. So it's wonderful that you're able to see the positive impact of it.
For sure. And then just some of the things that, changed our thinking. So we kind of wanted to position this as, I liked how you phrased it, Heidi, a pillar to our overall well-being strategy. We wanted to make sure that wasn't overlooked, and make sure that's frontward facing to a lot of team members. As I said before, we have a very diverse population. We have some people that are in trucks all day, not every day, that would be illegal, but all day, most days of the week. And, it's hard to get in contact with them through electronic methods. So we send postcards, we send mailers, we're trying to send text messages, but we send notifications through Transparent, things of that nature. So just making sure that we make this important, and we know that the team member knows that this is important as well. It's often one of those conditions that are overlooked and sometimes has a bias. Like, we often see the female population have a stigma towards sleep apnea. They're like, oh, that's only something that guys get. I'm just a snorer, so don't worry about me. But, we're trying to fight that stigma. We're trying to encourage people to at least get tested, right? Because you never know if it's an issue until you get tested. If you even have an inkling in the back of your mind, it might be an issue, and that might be causing, some parts of your other lives to be impacted. For example, one of my friends, she got terrible sleep and she was just groggy every day. And then at a certain point, she just started snapping. Like, you would say the smallest thing and she would just go off the rails. And I'm like, have you been tested? Like, do you have sleep apnea or insomnia? Because she hasn't been sleeping well. Once she started getting treated, it was like a completely new life for her. So, just making sure that, not only are we capitalizing through communications, but on a personal basis too, just checking in on team members when it looks like, hey, you all right? What's up? So it's a bigger impact for sure. And then accelerating path to sleep care. We did send out a postcard around Christmas time, just basically being like, hey, have you gotten your sleep? You should really get that checked out if not. Because if not, it may not be as treacherous as you think. Because with, Knox's health model, it's definitely significantly a shorter timeline than the 3 to 6 month wait period. I know local in Tennessee, I know several folks that I am friends with that are not on our healthcare plan. They have to wait about, I heard something crazy like 6 months. And I was just like, holy cannoli. And this individual did have narcolepsy. So that's kind of frightening. That's a very serious condition. So just making sure that you're getting the services and the support that you need when you need it. So meeting you where you're at. So just making sure that they know that this is an accelerated model, making sure that they're very aware that this is an accelerated model. Because once again, we're in the time of instant gratification, which is great, but some things take time. But this is kind of meeting in the middle and making it a lot more efficient for sure. And then the last thing that really changed our thinking is how many touch points in this program there are. I think with one of the things that we're going to capitalize on a little bit later in the program is there was one individual that had 30 touch points throughout their journey. And that is huge, because I think of people like my father. We have in our demographic ages from 16 to 70 plus. And I think of my father, he's over the age of 70. He hates technology. So anytime he goes to his standard, physician, they're like, hey, did you read your MyChart notes? And boy, does he not even know how to access MyChart. So he's like, no. And then they're like, well, just reference your MyChart. And he's like, I can't. So just having that person that you can talk throughout the entire process to help support you through that journey is just pivotal. Because, some people like technology, some people hate technology. So having that person behind the screen kind of support you through your journey and answer all your questions is just huge. And then why Pilot chose Knox. It really aligned with a lot of our strategies and our overall thinking of how we want to show people that they matter at every turn. One of the biggest pivotal pillars that we would like to address is workplace safety. So just making sure that they can be 100% present, not only at work, but at home, making sure that, they can go to work and they can be 100% vigilant and be 100% themselves. And, not have to worry about being tired or having that nap at the end of the day, or dang, I wish I would have that nap right now, because then that just bogs down the brain for, very important safety, thought processes. Like, I think it's crazy because I think we were told with a forklift, there are 24 plus pivotal points where you can have a safety incident. So think about how many things are subconsciously happening when you're just operating a forklift, let alone a truck that has diesel in it. So just making sure that they're there. Then comprehensive sleep care, that's a huge one, right? Like just making sure that your specialized case is being addressed in the way that you need it to be addressed. Once again, if you get that sleep mask that doesn't fit, you can always send it back, get a new one, get one that fits your needs, right? Because we have some people that are traveling day in and day out that need specialized sleep masks. And then I think I'm going to bundle the next three, and it's equitable, ease, and access to sleep care. So making sure that everyone, regardless of where they're at in the US, they can access this program and things can be delivered to them. Everything can be done virtually or through the telephone. And just making sure that they get the experts that are needed is huge. And making sure that the care that is provided is 100% the best care, and making sure that they feel supported through that journey. And then as an ease of implementation, it's very easy to just, start the process as a team member. It's very easy to continue the process because once you start that process, there's someone being like, hey, what's up? You doing all right? You sure you got that sleep test done? We really want you to get that sleep test done. Making sure that, everything is supporting them throughout that journey from start to finish, and just showing them that everything is okay, even if they do have to have treatment for something, right? Like some people think sleep apnea, they think of a, medical term, and they're like, oh no, I have something that I didn't know that I had. And now then they start to worry. So just having that advocate for them is huge. So I think those are some of the key pivotal points throughout this process and why we chose Knox ultimately. Some of our outcomes that drove a lot of our progress and showed us that this is a really good program and a really good thing to have a strategy around is just seeing there are two favorite metrics that I have, and that's adoption and adherence and persistence. Well, three technically. It's that first graph there. It really shows you how the traditional services that are rendered for sleep health, they're not as effective. They kind of say, hey, here's your mask, good luck. Whereas, having that advocate for you, making sure that you're staying on your program, making sure that, you're staying persistent and making sure that you stay with the program, right? Once again, instant gratification is the thing. But once you're on the program for about a month, 2 months, you start seeing those slow, impacting changes. You become more present, not only in your work life, but your present life. You start seeing other conditions start to get a little bit better because you can be more mindful about your decision making. It's huge for our team members. And not only that, we do have a very good return on investment, which is really good because it shows that team members have an ability to make decisions that ultimately impact the program in a financial reason. They have control of, will your premiums increase this year? Because, if the overall cost of healthcare goes down for a company, due to those decision makings, it can ultimately do positive for the overall well-being and healthcare initiative. So showing people that their decision making can actually lead to fruitful outcomes for themselves as well is great. So those are probably my few favorite outcomes. And then this is my favorite slide throughout this entire presentation. It's just showing one core case with someone in our population. She was a 49-year-old team member. And once again, the stigma for female sleep apnea treatment is huge. Like a lot of people are just like, I'm just a snorer, so I'm just going to live with it. But we saw her get care within 40 days. We saw her successfully get acclimated. And we saw comorbidities go down once again. And that's where the adherence comes into play because it's not like overnight her blood pressure went down. that was the adherence that was working there. So it helped with other comorbidities that she was probably taking medications for. So, just addressing that as a side factor is huge. And then she loved the fact that there were 30 touch points throughout the entire process, just keeping her not necessarily in line, but well informed of what the journey entails, because a lot of people don't understand. Me, myself included, I've only been in the healthcare space for about 2 years, and I learn something new every day. When I learned that if you take ownership of your health style and your decision making with health choices, it's pivotal to your overall, success with your health journey. So having that person, that advocate, be like, hey, you just got to keep on going. You got this. Adherence is key. You'll start seeing improvements over time. And that's where she saw, this reduction in their AHI levels. And, the fact that she did, have the compliance rate of 97%, right? It's just having that advocate on your side and your team that really drove those results for sure.
So Shannon, I'm going to throw it. I love this case for all the reasons you said, because you're right about women and sleep in general. It's definitely with sleep apnea for sure. And this is around the age where it's right around that menopausal time that you really see an increase in sleep apnea in this population. And it's not always super obvious because insomnia also happens around this time. And actually a lot of your symptoms for sleep apnea tend to look like insomnia symptoms as well. And so it can get missed. And there is a stigma. You're 100% right. That's there. And so it's that combination. So I love seeing how well she responded. And you're right about the touch points. You don't realize how many may be needed for someone to be successful, right? Because it is a behavioral change that happens. You got to get used to using this and make this a part of your daily life. And the quicker you do it, the more likely you'll be successful. But it's hard, right? You don't always find the right mask initially. Pressures may need to get changed. There's a lot of things that have to happen. And so it's wonderful to see that then the bonus of her being able to come off her blood pressure medication.
100%. Yeah. And it's team members like this where we just hear nothing but raving reviews about having the access be easy, and not only easy, but kind of supported. And that's the biggest thing through healthcare. Healthcare is a confusing place. So I feel like just having that person to kind of be like, hey, this is how it's going to go. And this is the why. I feel like the why is often overlooked, and having that person to tell you the why is crazy good. So yeah, totally agree.
You're right. It does empower you when you know the why.
Yeah, for sure. And then you can be like, I actually have ownership of my own decisions. So that's awesome, because often in the healthcare space, you're told by a doctor, hey, you need to get surgery. And then you're just like, but why? And then they're like, gotta get surgery. So yeah, it just helps them better understand the benefit that they're providing to themselves for sure. And just as some key takeaways, sleep is foundational. The way that we designed our benefit plan, we wanted to make some of our, vendors that are centers of excellence be frontward facing, just to make sure that people know that vendors like Knox Health do exist in our benefit design, and it's easily accessible to those that are on the healthcare plan. And just making sure that we keep an eye on the outcomes that result from these folks that are in these programs, which have been phenomenal, and just making sure that, sleep does have a seat at our overall vendor well-being table. We actually have a summit every year with all of our vendors, and they cross collab, and they just come up with the most innovative ways of solutioning for issues that are in our population. So just seeing how sleep, Knox Health can interact with our EAP, and our EAP can interact with our diabetes management program. And the three of them combined can come up with these innovative strategies that just are mind-boggling, because people just don't understand that, there's so much overlap with your health, and addressing each pivotal part of your health is just crucial to your overall well-being. And then Lynn, I would like to pass you off for Q&A.
Great, Cheyenne. Thank you. That was a wonderful conversation. So much good information. We do have some audience questions submitted. And the first one I'll put to you is, How should benefits leaders evaluate sleep care differently from other point solutions or specialty benefits? Dr. Riney, would you like to start?
Sure. I mean, I think a lot of it, and Sean did a great job in kind of understanding what was really important. I think when we see that overlap, and I love that you have that summit where, and I love that we have that seat at the table where we can talk to really the other solutions that you have, really that are tackling these other health conditions and other benefits that your employees have, but really how do we work together? Because a lot of it is that, right? None of these things live in silos. And I would say sleep is really that horizontal that has the ability to both negatively impact all these other conditions if it's not being addressed, but can positively impact all of those other conditions if it's integrated and as part of a program and part of an offering. And I think that's really important, right? What are the outcomes that you should be seeing? And I think that's one thing we see with sleep in general is if you're not able to see the outcomes and really see the benefit to your employees, then I think that's where some of the challenges are in that traditional system.
Cheyenne, do you have anything to add?
Oh yeah, and you basically did everything I was going to say. So the only thing that I would also add to that is potentially making it more frontward facing, because I feel like some other center of excellence vendors like cancer and diabetes, they are frontward facing. You see them all over the news media. You see them all over, I watch Good Morning America and it's always on news platforms and it's kind of being put frontward facing, but I don't hear a lot about sleep. And I wish that was different. So, just putting that more frontward facing, being like, hey, did you know that sleep can impact X, Y, and Z? Hey, did you know sleep can, be combined with these other conditions that you may have? And just making sure that, team members know that these are conditions that are okay to have and are very likely to have is definitely pivotal for sure.
I love that you say that because you're right. There is, it's the whole why, right? The education is power, right? If people understand what the link is, then they're more likely to want to address it, right? Especially if you know that there is a solution out there and it is accessible. But you're 100% correct. If people don't know, it's hard to be able to say, is this something that should be front and center in my solution? So I think that's wonderful.
Thank you. Next question is, what metrics should employers focus on beyond utilization when measuring the success of a sleep program?
I can kick that one off because I'm the data junkie. I think the three that I capitalized on the one slide, which is, utilization, did they actually start the program, adherence, and persistence. Those are the three pivotal metrics to make sure that, you're measuring well against your book of business. And then I think the second one that has been extremely helpful for pilot is cohort analysis, right? Taking a group in your subpopulation that don't utilize, a Nox Health, but have been diagnosed with sleep apnea, but hasn't gotten the treatment for it, versus someone that did utilize Nox Health. It's very empowering to see that even the slightest decision of just participating in a program can create such impactful results. We see reductions in A1C levels, we see better mental health, we see lower risk of alcohol abuse. I think there was one person during a well-being fair that was joking around about needing a nightcap in order to go to sleep. And it's just oh, no, that's bad for you. So you should really consider other options to, better your sleep health. So just seeing the differences between those that do that initial engagement, even an initial engagement with Nox Health, in comparison to someone that was just diagnosed with sleep apnea and didn't, choose to move forward with any treatment. It's mind-boggling with how much their other comorbidities lessen over time from a team member cost perspective as well, because they have to go to the physicians less once those comorbidities, I can never say that word right, lessen. And, they overall see a better impact in their just life, because I know myself, I would rather not go to a doctor 20 times in a year rather than going to a doctor 2 times a year. I would not want to go 20. So, you see those positive impacts in those cohort numbers, not only in the numbers, but, you put a face to that number and you're just dang, receive less visits for you, that's awesome. But yeah, do you have anything to add, Heidi?
I mean, I think you again stated that perfectly, and it's that positive reinforcing effect, right? So you have that negative cycle, I think, with people, and I'm going to kind of go off the tangent. I know we're talking about metrics, but I think when people can see those positive metrics, I'll say, if we know that it can negatively impact those chronic conditions and how they feel when they're not addressing their sleep, but then it's so powerful when they do treat it. And yes, they see their numbers are good. We see those, are they adopting and are they consistently using it? So are they adhering or persisting? But then on top of it, like the one that you shared before, her blood pressure got better and was able to come off medications. That's really a big deal for someone to say, I need to stay on my therapy because I know that this was the one intervention I did that did this. And then it also has that positive effect where now her primary care may also say, hey, I'm seeing someone with this. Should we address their sleep? And you see that happen. So I think you're right. When you can measure the whole picture, it is a holistic approach, right? Someone's A1C getting better, being able to not have to go on insulin, maybe be able to come off of some of their other medications for diabetes, or even just how you look at food. So I'm on a weight loss journey, and now maybe my metabolism is faster if I'm able to do this, or the things I've been trying to do are more effective because I've addressed my sleep. So there are so many positive impacts, you're right, that happen. So I think it's another outcome to look at, right? What are those clinical improvements? And I love that you guys are tracking and able to see that.
Dr. Riney, the next question is, can you elaborate on what treatment is received?
Absolutely. So it depends on the disorder. So we'll talk about a couple of the ones. So, we've been talking a lot about sleep apnea. And so sleep apnea first line therapy is something called CPAP, which is continuous positive airway pressure. We actually use something which is an auto adjustable device, or there's some advanced devices depending on someone's sleep apnea and maybe the nature. There are different types of sleep apnea. Obstructive is the most prevalent that we see. And that is something that we would take care of with the patient, educate them on how to use it, and support them throughout. As it relates to chronic insomnia, which is the second most prevalent sleep disorder that we see, first line treatment is something called cognitive behavior therapy for insomnia, or CBTI. And CBT is something that we actually are able to offer here as well. So it is a 6-week program, and it is a digital solution. It's the first FDA cleared digital therapeutic called Somnus is what we offer. And we do that in concert with our behavioral care team. It's also overseen by our behavioral psychologist who oversees the program. And what it does is essentially it looks at what's perpetuating your insomnia, right? So what's making it more difficult for you to fall asleep or stay asleep, and working on maybe the negative thoughts that go with it, and then creating behaviors to try to address it and treat it. And we know when people go through it, we see long-lasting reductions in their insomnia. And for many patients, they can have remission of their insomnia. And that is key, right? This is something that can be all-encompassing when someone has to deal with insomnia. We have had maybe a couple of nights, but someone who does it chronically. And what chronic insomnia means is you're having at least 3 nights of insomnia for at least 3 months. So 3 nights a week, 3 months, and for many it's years. And it can impact every part of their life. And so to get remission potentially with it is it's life-changing. And typically for what people tend to get are medications in the traditional sleep environment. So CBTI, not a lot of people are aware of it. When we talk about the health desert, when you talk about finding a behavioral psychologist who can offer it, it's really hard. There's only about 600-ish in the whole country, and they're really concentrated around academic centers and urban cities. And so having something that would work for all was crucial when we had this program. And to be able to see those results is phenomenal. So that's what we would do on the insomnia front. And then avoid medications. Is the other parts and put is what tends to happen is when people aren't able to get access to it, they tend to get prescription medications. And unfortunately, the medicines they tend to get are controlled and are often written longer than they're supposed to get it. It's not first line. It's really there as an adjunct in addition to CBT for short term to get someone over the hump if it's depending on the severity of their insomnia. The other disorders we treat are restless leg syndrome or sleep-related movement disorders is probably the bigger category. Often we see that coexist with sleep apnea or insomnia or others. So sometimes with that, it may be looking at medications or behaviors that may be exacerbating it, maybe checking blood work, or in some cases, maybe medication to treat it. And then the other is circadian rhythm disorder. So that's where a misalignment of your internal clock and when you actually go to sleep. Shift work disorder is probably the most common thing we see. So when we have drivers, others who are working maybe hours that aren't going to be aligned with when they would want to go to sleep, that can cause tremendous issues with insomnia, because now you're going to bed at a time that you wouldn't normally, and a lot of fatigue and sleepiness. And that often is really working on schedules as well as circadian clock. So maybe light box therapy often is the case, and really just kind of working with our physicians.
Very good. Thank you. We probably have time for one more question. Would you please recap the cascade of how candidates for sleep interventions are identified, surveyed, et cetera, up through ultimately enrolling in the clinical program? Claims data, referrals, survey opt-ins?
So we can go, and I can go, and Sharon definitely jump in. So it's there's a lot of different ways to walk in through the door. We'll put it that way, so that you can identify people. So as Cheyenne talked about before, there are people who likely have it. And so actually claims data is not a bad way to understand maybe who has been diagnosed before and isn't on treatment, or maybe is, and hey, this could be a really good resource for them to know that they can transfer their care. Or for those who might have those chronic conditions that we see are often associated with sleep disorders, who may not realize they have it, right? So at least letting them know, hey, we have this option here for you. So it's an open front door, right? It may be that they on their own can schedule a consultation, and that can be done within days. And that can be done at a time that works for them in their home. And we do have surveys that are validated looking at the different aspects and different sleep disorders, so people can get more information about their sleep. And we have education as well on our platform, where they can maybe understand more about sleep and sleep health, and maybe, hey, is this something that's right for me? But then also we have partners that, Sean was talking about at Pilot, that would be another good resource, right? So if you're going to maybe an on-site clinic, or where you're getting your diabetes care, or somewhere else, and they know, hey, you might have something going on with your sleep, that's another really good way for people to be aware of the benefit and to know, hey, sleep may be impacting this. And that's another really good way to come in the door. And I can keep going through the process, but Shane, I want to make sure I'm not missing anything or anything else that you want to add.
No, I think those were our two pivotal ones. We have done targeted communications based off of claims data. So I really liked what you touched on in the prior question, being the prescriptions that people are taking probably a little bit longer than they should. We have done claims data where we see the longevity of some of those prescriptions, because if those prescriptions are taken longer than they should, they actually have detrimental impacts in the long term. So they start seeing other issues arise due to being on those prescription drugs. So we try to be proactive, and we try to say, hey, just so you know, we're seeing that these prescriptions are being used, just want to direct you towards Knox Health in case that's something that you may be interested in. Also, to Heidi's point, we do have several vendors in our well-being platform, one of them being Transparent. They have a survey that's kind of conducted every year, where it kind of assesses where you are in your healthcare journey and how you feel about your health. And if they say sleep is one of my things I really want to look out for, it'll actually prompt them, hey, do you know that Knox Health is a thing, is a benefit that's offered to you at practically no cost. So just making sure that's more frontward facing to the team member is definitely a way that we get a lot of people in the door.
Well, thank you so much. Sadly, we are going to have to leave it there. It's been a wonderful conversation, and appreciate it from both of you. If we didn't get to your question, Knox will follow up with you offline. Thank you for joining us today for the webcast, and I'd especially like to thank Cheyenne and Dr. Riney for being here and sharing their expertise and experience. If you missed any part of the program, you can hear a recorded version within 48 hours on the EBN website, and we'll send you an email with a link to that recording. Thanks again for being with us, and have a great rest of your day.